Good afternoon and welcome to today's SAMHSA-sponsored webinar titled Understanding, Connecting, and Helping Youth Mental Health Through Screening featuring MHA Oklahoma. Today's presentation will be recorded and the recording link, slides, and certificate of attendance will be sent via email to everyone who attended today. Closed captioning is available and can be viewed by clicking on the CC icon at the bottom of your screen or clicking the link in the chat pod to view in a separate window. We also have an ASL interpreter who will be spotlit on your screen. During the presentation, please add your questions and comments in the chat box, and questions will be asked out loud for the presenters to answer at the end of the presentation. When the presentation ends today, a brief survey will show in your browser. Please take a few moments to complete that for us. Thank you again for joining us, and I will now turn this over to Jackie Zimmerman from Mental Health America, who will introduce our speakers and give a brief overview of today's webinar. Jackie, over to you.
Thank you so much and welcome everyone. We are so thrilled to have you here joining us today. Please feel free to head on over to the chat. Give us a greeting. Let us know where you're tuning in from. We would love to hear from you. Just note that your mics are off, your cameras are off. It'll stay that way, but we encourage you to use the chat throughout today to ask questions, make comments. So I see those greetings coming through. Hello, hello. Hi, everyone. It looks like we have folks joining from all over. How wonderful. Well, thank you so much for being here and joining us for today's session, Understanding, Connecting, and Helping Youth Mental Health Through Screening. My name is Jackie Zimmerman, and I'm the manager of our public education partnerships and e-learning at Mental Health America's national office. I'm joined here today by Mental Health Association Oklahoma to discuss their use of screening with youth. We'll hear from them about the benefits of implementing school screening tools to help identify mental health concerns early and prevent those long-term consequences of poor mental health. And they'll also give you best practices for engaging and building relationships with schools. They'll review how to use screening tools to identify and detect mental health concerns. And they'll also kind of go through the process of program introduction, screening, referring, and case management, and what that has looked like in their community, and give some tips for what this could look like in your communities as well. We will have time for Q&A at the end of our session, so please feel free to be putting your questions in the chat. And as we go, we will be collecting those on our end and have some time to answer a few at the end. So please feel free to add your questions. We want to note that this webinar was created by MHA and MHA Oklahoma. The views, policies, and opinions expressed are those of our authors and do not necessarily reflect those of SAMHSA or HHS. But we do want to thank SAMHSA for sponsoring today's webinar and making this information available to all of you. Without further ado, I'll introduce our guests we have joining us here today. First, we have Dr. Cheryl Delk, who is the Youth Mental Health Manager at Mental Health Association Oklahoma. Cheryl will be here to share with you all about their screening program. And she is joined by Chelsea Gordon, who is the Youth Mental Health Specialist in the Youth Mental Health Program at MHA Oklahoma. Welcome, Cheryl and Chelsea. We are so honored to have you with us here today to really help dive into this program that you have created that's serving youth so well, and for everyone joining to learn from you all and hopefully leave with some really great takeaways of what this can look like and how it's helping youth in your community. Welcome to each of you.
Thank you.
Thank you.
So thank you everyone for joining us today. Chelsea and I are really excited to be here. Thank you, Jackie, for the wonderful introduction. And so today we're going to talk a little bit about best practices for engaging and building relationships with schools. Sometimes it can be very challenging. Schools, their job is to protect their kids, and we want to make sure that they know that we want to do that as well. We want to help them to provide support for those youth who might be facing mental health concerns and prevent that emotional disturbance and serious mental health illnesses. for kiddos. And so we're going to talk about YouthCheck. I'm going to talk about the beginning of how it started and the name change, and then how your program can infiltrate those schools near you to benefit the kids and the schools, as well as the parents and families that are involved. Next slide, please. So there's a plethora of research out there that supports screenings in schools. Early detection for all economic classes is important. We have to remember that our economic class doesn't ever really always protect us from having mental health concerns or mental health issues, because we are people, we're unique, we're individual. The way we view the world is the way our body reacts to it, the way our minds react to it. And having early detection can help decrease the likelihood of more intense mental health concerns and issues as the individual grows and becomes an adult. One of the things that I found fascinating in the research that supports school screenings is that we're catching youth that no one seems to realize are struggling. There was a study that talked about how teachers could identify kids who were struggling in their classroom, but they were not able to identify those who were more quiet all the time. So they didn't see any behavior changes because those students were always quiet. They were always studious. They were always in their own space doing their own thing. And those school screenings caught those kids at a greater rate than having them caught later in their school years. Those kids who were always happy and always involved were showing signs of mental health concerns, and they were identified by school screenings where faculty and staff didn't feel that they were having any concerns. And then one of the things that is really important about catching mental health concerns and issues early is that it does help prevent or intervene early the likelihood of comorbidity and illness progression in youth as they become adults. And so research is really supporting having those school screenings for the early detection for many, many, many reasons and for all walks of life. So, you know, mental illness does not isolate someone just because they're in a lower income or a higher income. So we just need to be prepared to say it's okay, and we've caught it early, and maybe this will prevent any further progression. Next slide, please. So Teen Screen. So Teen Screen was created by Columbia University, and the program here at Mental Health Association Oklahoma started as one of the pilot programs. Early on, when Columbia University decided to do this teen screen, they asked for individual agencies and in the communities across the United States to be part of a pilot program. And we just happened to do that. At the time, there was an individual who used to be the CEO here at Mental Health Oklahoma. He went out and joined us in on that pilot study. And so we started in on their data collection right off the bat before it was launched publicly in 2003. And they used the DSM-3. That was what was out and updated. And the really nice thing about the Teen Screen is that it wasn't, we as programs across the United States, we weren't diagnosing students. It could be used for that later on, but we did not use that as a diagnostic process. What we did was early detection, and so it was endorsed by SAMHSA and at the National Registry for Evidence-Based Programs. And then in 2012, Columbia was no longer involved with the teen screen. And so, but we continued to use the screening. Originally, it was a disc that was loaded onto a computer, and the computer-generated questions were answered by the students. Next slide, please. So now Stanford has it. In mid-2015, Stanford took over, and they changed the name to YouthCheck. And one of the main reasons they changed the name is because a lot of people would reach out and they thought that it was an assessment for youth to be diagnosed so that they could be accepted into clinics or by clinicians. And so Stanford felt like, well, if we change it to YouthCheck, then we can call it a check-in. And that's really what it is. YouthCheck literally checks in to see how individuals 11 to 24 are currently thinking, feeling, and behaving. And it does ask questions about suicide. And Chelsea will talk to you more about the screening process later. But we have been a part of that, thankfully, with Stanford. We can offer this screening for free, and it can be used many times. So there's no time set for it. And they use a database called REDCap. And so originally it was paper surveys, and now it is all administered electronically. And Stanford does hope to develop a new infrastructure for the program with long-term goals of sustainability and national expansion. And they're in the process of doing that. You can change the slide, please. So this is us. I used to have a cohort that was on the Oklahoma City side, and now it's just me managing both sides of the turnpike here in Oklahoma. And all of our youth mental health specialists are licensed clinicians, because sometimes when you take this survey, they are in a crisis, and we want to be prepared to help those youth. And if we're in a school, then we follow the school's protocol. And so, but we just feel like it's more important that licensed mental health clinicians administer the screening than individuals who are not familiar with mental health concerns and crisis to begin with. So very grateful. We would not have a youth mental health program without our youth mental health specialists. They are the individuals who really know how to work with the youth and administer this screening in the best possible way. So one of the most important things about our program is access to schools. Schools are really leery right now, with especially since COVID, in letting people come in. Their job is to protect their youth and keep them safe, and we absolutely support that and understand that. So we have a lot of meetings. We introduce our program. We let them know we're not diagnosing anyone. We're not providing counseling. We make referrals to mental health specialists that are based in the community. We work with the parents. And that is another wonderful thing that schools think is, oh, we don't have to do any work. We have no additional work if we allow the youth mental health program to come in and administer the YouthCheck and have a screening event. All we have to do is pull kids out of class. And so that is a benefit for us, is that we're doing all the work, and no counselor, no administrator, no teachers have to work with the parents, make the referral, work with clinicians outside of the school. We do all of that. There is a process called a memorandum of understanding. And what we do is we let the school design that memorandum of understanding. It's their school, it's their home. We want to respect their policies, and we are flexible and adaptable. We do, however, have boundaries. Like I said, we do not do counseling. We do not provide any other services but the screening, education, referral, and the little bit of case management of following up with parents later. And if the parents want us to speak to the community professional outside of their realm, then they sign an ROI, and we do that for them. But at the end of the day, we want the school to be in charge of what we do in their school. And so every school is different. We have a really large school district, And there are 83 school buildings, and every administrator is different. The MOU covers education and screening, referral, and follow-up. And some schools just have us come in and do mental wellness education. But sometimes that's the foot in the door we need for a screening event. And so we're available. We try to be available as much and as often as needed, because we want those school districts, those school buildings, those administrators to really think that we are their ally, because we are. We're here to serve their students. We're here to serve them. We do offer statewide services here in Oklahoma, and we have traveled to schools that I didn't even know existed and met some of the most wonderful people. And so we are free, we're available, and we really enjoy our relationships with our schools. Not only do we work with schools, but anyone can fill out a website form if they would like for their child to have the screening done. And once they contact through the web form, that comes to me. Then I call the parent, and we have a discussion. And if they're interested, then we follow through with the parent guardian consent. But just having that access to schools is really important, because, as I stated earlier, a lot of schools, they're just afraid to let somebody from the outside come in with something new. And we work really hard to be genuine and honest, and this is what we can do, and we'll do it however you need us to get it done. Next slide, please. And so the impact of COVID, this, as I stated earlier, when the screening process started, it was paper form, and then COVID hit. And we had to take an in-person only program, and we had to revamp it to be virtual. And there were actually, believe it or not, a lot of schools that liked the virtual. We had a school where the principal set up a computer in her little side office. And once she got a list of the kids whose parents consented to them having the screening, she would call them in. They would shut the door. They would take the survey. Then they would, talk with Chelsea over the screen. They would leave, and the principal would call the next student in. And it worked out really well. And so now we do screenings in person and virtually. However, the consents are 99% virtual. So that is one of the things to cut down on paper use. And so parent guardian consent is required of anyone 11 to 17 years of age. And they go through that consent with me. One of the things that it states on our parent guardian consent is if the youth does not want to complete the survey, the screening survey, we're okay with that, because we want the youth to have a voice. And I'm going to let Chelsea talk a little bit about that process. But what we have found is that youth who know they have a choice, that they do not have to do it, even though mom and dad said they had to, they are more likely to follow through with that screening than they are if they'll give us more genuine answers. So our data is not contaminated, right? If mom and dad is making me do this and I really don't want to do it, I'm not going to be honest on this survey. So if they know they have the right to say no, they are more likely to really say, okay, I'm going to answer these questions how I feel right now. And so now I'm going to turn it over to Chelsea, and she's going to talk to you about what she does, how she works her magic. And there you go, Chelsea.
Thank you so much, Cheryl. Next slide, please. Okay, so what I'm going to do is I'm going to do the overview of the screening process, where I receive the student until we are done completing the screening. And then after that, I'm going to focus on the screening specifically. I really like to call it the quiz. And so next slide, please. Okay, so as Cheryl mentioned before, we used to not be virtual until COVID. And so now that we are virtual, we can screen anybody throughout all of Oklahoma, which is wonderful because before then we were kind of, beholden to where we are locally, and we are reaching students that otherwise wouldn't be screened by our program. And so one of the things that happened whenever COVID happened was the schools, they weren't letting anybody else in. And so up until that point, that's how we were screening. And so one school in particular I was thinking about is the principal actually took it upon herself to be the one, kind of the gatekeeper, to still keep the screenings going. And so she was able to pull the students herself and set them up virtually to where I was still able to screen kind of in the schools, but we were able to do that virtually. And so the virtual process and the in-person process are kind of different. But whenever a parent gets a hold of us, and after Cheryl talks with them, she connects them to me, and then I figure out when a good time to meet with the family is, and then we set up virtually. Now, if I'm in a school, I get with the school personnel, we want to make sure we avoid any state testing, that kind of thing. And whenever the student is in front of me, the very first thing I do is I want to let them know, they're not in trouble, because a lot of times they don't even know who we are. Sometimes our consents are in the enrollment packet at school. And so whenever a student comes in, they're kind of nervous. And so my goal is I want to make them as comfortable as possible. And I want to make sure that they know, hey, we're just going to have a chit chat. And so the consent form, I pull up and they can read it themselves. I let them know, hey, you're more than welcome to read this. I am going to read it out loud. And basically what it is it's an online form that they fill out. They give us their name, their grade, their age. We do ask for their email, because at the end of the screening, I'm going to send resources to the parent or guardian, and I want to be able to include them as well, with parent permission, of course. And so at the very end of the screening, it says, like, Cheryl mentioned, we're not going to make anybody do the screening if they don't want to. They do have a right to choose. And so it says either they want to do the screening or they don't. Whenever I'm at a school, I do have a handful that decline, but that's pretty unusual. Usually the students are like, yeah, I'll go ahead and give it a shot. If they have any questions, I say, hey, let me know. And so I kind of give a little spiel. The first thing I let them know is this is just a check-in. You are not going to be diagnosed. You're not going to be labeled anything. It's just seeing if you're struggling in anything covered on our quiz. Our quiz goes over symptoms of anxiety and depression. And so we're just going to talk about that a little bit. If they do happen to score a little high in something, I'm just going to ask them a few more questions, maybe to get a better understanding of what's going on, right? And then definitely it's an informed consent form. And so we want to let them know the limits of confidentiality. And so I tell them, if at any point you report to us that you are a harm to yourself or others, we legally have to tell another adult. And so sometimes students are like, oh, well, I'm not going to tell you nothing, and they decline, and that's okay. We're still going to have a conversation and maybe still give referrals to the parent or guardian. And positive and negative screenings. And so, as I mentioned, sometimes students decline, so we don't even get that far, which is okay. Negative result is the computer does all the work for the screener, which is really nice. And if the student puts no, that they're not really struggling with all the areas covered on the screening, then the computer gives a number. And if the number is below, and I'll go over all this later, if it's below a certain number, then it's automatically a negative. There are several ways to make a screening positive. And so if they're total overall symptom score is a 9 and above, that's an automatic positive. If their impairment score is a 6 and above, that's a positive. And again, I'll go over that a little bit later. But after the screening, we do a debriefing form. And on that debriefing form, it says, whenever you were taking the quiz, did any thoughts, ideas, or concerns come up that you would like to talk to somebody about, maybe like a mental health therapist? And then that automatically makes the screening a positive if they answer yes to that question, because we want to connect the family to resources. And then definitely whenever we get to the depression questions, they could have said no on every question besides one of the suicide questions. And if they answer yes to either they have had recent suicidal thoughts in the last 3 months, or they have had a suicide attempt in the last year, automatic positive. And then the last way for the screening to be positive is if the screener deems it positive for any reason, maybe something that's said on their own volition. And then the red cap, we will go over that after I'm done with all the process. So next slide, please. Clinical interview. So the clinical interview only happens if the screening's positive up to this point. And so all the clinical interview is we're just gathering more information. And so the first set of questions in my head, it's to build rapport. My goal is to build rapport very quickly, because if I have that buy-in, chances are the student is going to be more comfortable to maybe share some information that they wouldn't otherwise. And so we have questions gathering information on, how's home going for you currently? How's school going? What kind of grades are you getting? Do you have a friend or a best friend that you feel like you can really trust? That's a question on the debriefing as well, is we want to see if they have a trusted adult or someone in their life that they can share with. And then after those questions, it goes straight into, it's basically a PHQ-9, right? And so it has depression symptoms. It talks about, are you experiencing any irritability? Are you having trouble sleeping? Is there anything you used to enjoy doing that you don't enjoy doing anymore? Do you have any appetite or weight change? Any feelings of guilt or worthlessness? And then any feelings of hopelessness? And that question I really feel like is vital, because we want to know how they're feeling about their future, and definitely how they're feeling internally at this point. And then after the depression questions, we would like to know more information on any suicidality, right? And so we're asking, hey, have you ever thought about suicide? Not necessarily recently, just anytime at all. And then if they answer yes, okay, well, when was the onset? When was the first time you had a thought like that? And then we want to know recency. When was the last time you had a thought like that? Any frequency? Have we noticed any patterns? Is it, oh yeah, every couple of weeks, every couple of months? And then have you ever had a suicide plan? If you did, was it pretty specific, vague? And so I'm asking all these questions, and I want to know if the student knows what their triggers are for those suicidal thoughts. Do you have any deterrents on maybe why you haven't attempted, or why you haven't attempted more? And so I love scaling questions. I always ask on a scale of 1 to 10. 1 is wanting to be alive, and 10 is wanting to be dead. Where do you fall on that scale right now? And then also, I feel like a really important question is, does anyone know? Because I have students who, they share with me, yeah, actually I have had suicidal thoughts, but nobody knows. I haven't told, my guardian. I haven't even told a friend. And so sometimes I'm the first person they're telling. And I do have students who they seem, like kind of reserved, like it's they almost seem conflicted, like they say no to these questions, but they kind of pause, and they're kind of, and so my goal isn't to make sure they're telling me the truth. It's whatever they're comfortable telling me, but we're still going to have a conversation with the guardian, right? And so after this set of questions, it asks more on anxiety. And so do you have any social anxiety? Is there any other anxiety you feel like that we haven't talked about yet? And they also ask for impairment. And so if you do have anxiety, is it affecting you negatively in any aspect of your life? Are you having trouble maybe going presenting in front of the class? Or are you having trouble going to maybe a party that sounds fun, but that, there's going to be a lot of people there, and so you decide not to? And so we're just trying to get more information. And then at the very end of the screening, I do ask, what is the most stressful thing in your life right now? I want to know, is there any areas that you would change if you could? And then we do ask if they have been in therapy before, and if so, how did that go? I want to gauge, because sometimes students, they do the screening and they're already in therapy and they just want to see maybe how therapy is going for them, which is wonderful. And other students, maybe they had a negative experience. And so I feel like all of that information is very vital for me to know. And again, it's just, whatever they're comfortable sharing. And then at the very end, we do talk about the results of the screening and, kind of what they think. Do they feel like it was accurate or not? And then, what do they think about counseling? Are they interested in counseling? Maybe not. If they are, what does that look like for them? And so are they interested in maybe only talking to a female or a male? Or do they want virtual? Or would they prefer somebody in person? And then we usually, if they're at a school in person, I've already had that information because I worked with staff to determine who is embedded in that school. And so I feel like a handful every time out of school, the agency that's embedded after, parent permission, of course. But I talk to the student because some students are like, that would be really convenient. I have a lot of extracurricular activities. I don't have any time to go see somebody. Bam, like, problem solved. Somebody's at the school that can see them. And so they don't have to figure out, when they can see them on the weekend or if there's any transportation issues. And then other students, they're like, that sounds awful. I don't want people to know I'm talking to somebody. Okay, I need to know that information because I'm going to, try to help them find a good fit. That's definitely my goal. And so that's kind of the, clinical interview in a nutshell. And then referral determinants, I kind of talked about that already. I want to determine, what they want. And then later after the screening, whenever I do make that phone call to the parent or guardian, I want to see, what the parent thinks. And then at the very end, before the students leave, I give them the crisis text line and 988. And so they have resources before they leave my presence. I want to make sure that they know that immediately, because sometimes, getting started in services can take a little bit. And so, whether it takes a week or two or whatever, they still have somebody and they have an avenue that they can utilize if they ever need it. And sometimes, they don't need it. Maybe they have a loved one or a friend who can need it. And so I want to make sure they do not leave without giving those resources. Another resource I give them, every student, whether they decline, before they leave, in addition to the crisis information, is support groups. I researched some online support groups that I love, that I give to students that they love. There's one that's kind of like a blog. And so I want to make sure that they have resources when they leave me, just in case. I've had parents say, we're not really interested in counseling, even though the student wants it, right? And so I want to give them something that can hopefully be helpful. And then the survey is at the very end, right before they leave. Hey, before you leave, can you fill out this really quick survey for me? It's got like 6 questions on it. And so we want to know, were they comfortable? Do they feel like the screening's confidential? Do they feel like something like this is beneficial for their peers? And then would they recommend the screening, right? And so sharing the results with youth, I pull, if we're doing virtual, I'm sharing my screen, I'm showing them. And we look at the screening together. And so I'm not trying to hide anything from them. I want to be completely transparent. And then I think I can't really see the bottom of my screen, but case management. And so sometimes the family are interested in other things besides counseling services. So I've had parents say, hey, I know you don't really assess for ADHD, but, is that something that you could help us find? Absolutely. And, one of the resources I give all the parents are parent support, because maybe the parents need support as well. And then I know that ROI, I think, is on there as well. And so I have sometimes the students that are currently in therapy, the parents want me to talk to their therapist. I need an ROI for that. And so I will give them a release of information, and I need the parent will just sign it in a written signature to give me permission, and then I can do that as well. And then also, any students that are 18 and over, sometimes their parents sign them up. Well, they're 18, so they get to decide. But if they want me to talk to the parent, they're 18. So I need written permission to talk to that parent. And so I'll just have them fill that out really quick. Next slide, please. Okay, so what are we looking for? So I'm going to hone in on the screening itself, right? And we actually have so many different categories that we can put in the screening, but don't. And so we have agoraphobia, we have mania, we have ADHD, we have OCD, we have conduct. I don't put any of those in the screening. I mean, it would make it a really long screening for one. But for instance, OCD, we used to put OCD in there, and everybody was popping positive for OCD. And so, unless the parent or guardian requests it, we don't usually put those categories in the screening. And so next slide, please. This is what is in our screening. This is an order. And so we want to ask demographic information right off the bat. We want to know the age, the grade, we also want to know how they identify, whether that's, gender or ethnicity. And then one of my favorite questions that we ask them is, who is your support? And so who do you feel supported by the most recently? And then also, who do you miss the most when you can't be with them? Because again, I'm gathering information. I want to know maybe how their family dynamic is at home. And then after demographics, we go into social phobia, and then I think panic attacks is next, and general anxiety. So they either answer yes or no. There's no maybe. Sometimes students really struggle with our screener because they think, oh, well, maybe there was that one time. And so all of the questions ask the last 3 months for the most part. Some questions ask last year, but we want to know current. Where are you currently? And then after anxiety, we have the depression questions. The suicide questions are in the middle. And so in the last 3 months, have you thought about suicide? Is our suicidal ideation question. And then in the last year, have you ever attempted suicide? If they answer yes to either one, they don't have to answer yes to both. But then again, it's an automatic positive screening. And so we just want to see where they're at. Again, it's not a diagnosis. And then oppositional defiant disorder, we want to see if they're having any conflict with parents or teachers, seeing if they're struggling in that way. And then substance use and abuse, we do ask for about alcohol and weed. And then they have an other substance section. It covers cocaine, heroin, like that's important questions to ask. And so we do have some students who they answer yes, and then I want to clarify because I want to see maybe if they'll give me more information. There was this one young lady who she was a middle schooler, and she answered yes to the question about cough syrup, and it asks, do you use it to get high? And she didn't read that part, and she said, oh, well, I use cough syrup, because I was like, oh, tell me about that. Do you mind sharing that information? And she said, yeah, whenever my mom gives it to me. I said, oh, okay. And she goes, yeah. And I said, when is that? She said, well, whenever I'm sick and I'm coughing a lot. Okay. Well, do you ever use more than what your mom? No. Okay. So then maybe, we want to assess, and we want to see kind of where they're at. And then impairment, we want to see, the previous questions are about their internal thoughts and feelings. And then the impairment questions are we want to see environmentally. How are, your thoughts and feelings affecting your environment? And so are you struggling, maybe with parent conflict, that kind of thing. And so please, next slide, please. So again, here's some example questions. And so this is our depression category. And so the suicide questions are in the middle. Again, most of the questions are, say, in the last 3 months. We want to get at, are you maybe having any lack of pleasure or interest? And then do you have any less energy than you usually do? Next slide, please. And then at the very end, like I said, it's scored for you. And so total symptom score is a 6. It's not a 9 and above. Total impairment score is a 5, so it's not a 6 and above. And then they didn't answer yes to suicide for this example. And so it tells you right there, further evaluation not recommended. This is exactly what I show the students. And sometimes, it's accurate and sometimes it's not, and that's okay. And so it really gives us an opportunity to give them, to have a conversation about it. And so absent means they answered no to everything in that category. Possible means they answered yes to 1 or 2. So what that indicates to me is maybe they're occasionally struggling with whatever that is. And then present means that they, answered yes to probably the majority. And so next slide, please. And that's Cheryl. And so I will just wrap up my portion real quick by saying after I talk to the parent guardian and I send in the resources, we do have a database that we use to put all of our information in case, maybe they want to do a screening in a year and see if they've improved. And so then after all of that has been done, Cheryl sends follow-ups to the parents and guardians.
Chelsea, you did a great job. Thank you so much. And I wanted to just emphasize one of the things that you said, which is really important in the current research, is that not only does the YouthCheck look at the within child characteristics and behaviors, but it also looks at how those environmental exposures play a role into that. And that's why I think YouthCheck is a really good screening for youth. And so we do follow-ups. At 2 weeks, I send a parent guardian satisfaction survey and just asking questions like, how satisfied were you with the screening? How satisfied were you with the overall interactions with the members of our program? The responses, have you been able to get in contact with the referral source? If not, are there any barriers to that? And so at 1 month and 3 months, we're really focusing on, was your youth able to attend any appointments with the referral source? Is your child still seeing the referral source? And if not, would you mind telling us why they're no longer seeing that person? Did you face any barriers? What were those barriers? And I think the most fascinating thing that I have encountered over the course of the follow-up, and just know that 3 months is a minimum. Chelsea and I have worked with families for up to 6, 8 months, sometimes a year. We're here for the families. Once they connect with us, they can always reach back out to us. But at 3 months, I'd have some parents send an email and say, hey, I got that survey. And I'm sorry I didn't do the first one and the second one you sent. I'm doing this one because I'm going to be really honest. We didn't call the referral source. We just didn't think it was that big of a deal. As a family, we decided that everything was going to be fine, but it's not fine. And would you still help us? Yes. Yes, we will still help you. We just don't not help anybody. Even if their child never takes that screening, they're already receiving services, but things are just getting worse. Our program supports that family. And one of the things that I've had happen is I've had counselors in the school. One of the schools that we work with has a mental wellness team. And I've had members of that team come up and say, parents are raving about your program because you don't make them do something for your health. And so this program, the screening, the follow-up services, the educational services that we provide, it's all free. And we're adaptable and malleable to fit any situation, any family, any school. And I think the biggest asset, as I said earlier, are our youth mental health specialists, because they are licensed mental health clinicians who can navigate that journey. And there's no bias. There's no, oh my gosh, I have to work with that family again. There's none of that. And so I just feel like this screening benefits the school, the youth, the parents, the extended family. It's a window. It's a window that might not be open, but guess what? We saw the crack in the window because of this screening, and it's benefiting everyone. And so, next slide, please. I think it's our video of one of the youth who took this. Chelsea actually knows this student, and so it's a really wonderful testament to the screening.
When, I was offered to do the screening, and it, was just like you can do this if you want. I was like, I really want to see just personally how much I've grown since my freshman year. And I also just wanted to really see, like, to really just kind of take the time and do a deep dive onto how I'm feeling, and how if I could better myself in any way, if there's anything that I still need help on, that I am just like, I don't know, sort of repressing, or I'm not really, I guess, paying attention to personally. If it would help to kind of bring it up to my consciousness and be like, oh, maybe I should, you know, talk to somebody about that, or, get help with it. Or it really helped me, like, kind of get an understanding of how I was feeling exactly. Sometimes it's really hard for, and I can't speak for everyone, but for me, I felt in the past that it was very difficult for me to really get a grasp on why I was feeling the way that I was feeling, and pinpointing, like if I was aggravated, or if I was just upset, or like that sort of thing about a situation. And I feel like that really helped kind of bring all my thoughts into one place. And in all, it really helped me identify the way that I was feeling. Someone who has struggled in the past with mental health, it really has helped to see, like, see my growth personally. Since I'm not dealing with that anymore, I'm able to look back at how I was feeling, and how everything just like it was everywhere all at once. And then being able to to do the screening, and then go, wow, I've really grown. Was very user friendly. I didn't feel confused. I wasn't like, what does this mean? Going through the actual screening, and like I said before, it really helped, like, going through each question, it helped me to sit there and think, like, am I really feeling that way? Or, I didn't feel like I had to, like, I guess, lie, or, because at the doctor's office, they give you that little questionnaire, but it's like, do I but this, I didn't feel like I needed to do that. I feel like I just could, take it. And it was great. I thought that it really helped me, narrow down my thoughts, go through each little section, and, just lay it all on the line. And it was great. I thought it was a very easy process. Yes, I realized that through, like, the answers that you can submit through the survey, I was like, I mean, if these answers are here, obviously other people are feeling this way, and I'm not the only one who, feels this way in a certain type of situation, or who has, gone through some of the same experiences that I have, and who are, their response to those are the same way that I had responded. And so it made me feel almost like just a deep breath, or like a weight lifted off. I was like, okay, like, I'm not alone. I know that I'm not alone. And it was really nice to know that, and to, be able to tell myself, like, other people feel this way too.
Well, I just want to say thank you so much for being here with us today. We really enjoyed using this screening. We enjoy the schools that we work in. We get calls every day. Like I said, we've been to places that I didn't even know existed. But it's because word of mouth. We have a lot of school personnel talking to other school personnel about the screening process. And then we're meeting on Zoom and describing the program. And then these wonderful youth mental health specialists like Chelsea, we have Amanda and Joyce as well. And they walk in the school, and then I get emails from the counselors that says, oh my gosh, we really didn't have to do any work. And we really love those ladies. They're so nice. And so on behalf of myself and Chelsea, thank you for having us today. And if you have any questions, just let us know.
Thank you, Cheryl, and thank you, Chelsea. That was all really, really helpful information. We have had some questions coming through in the chat. I will have a few of those for you now, and if we don't get through all of them, we can always have you answer and send some responses out to participants afterwards too. But again, thank you for sharing this information. It has been really helpful to hear from you, and especially that last testimonial was really great just to hear from a youth of their perspective. One of the things that she said that really struck me was, if this is an option of an answer, that means other people are going through it too. And I think that for youth, it can feel so isolating and like I'm the only one that this is happening to and something's wrong with me. And so just being presented with these questions really does open their mind to, if I'm feeling this way, it's okay. And it's okay for me to share that. So thank you. I'm going to jump into a few questions we had specifically about the program first. We've had a few questions similar to this one of how you find schools to give these services to. If you reach out to the schools to implement YouthCheck, or if your school board requires a contract, or if they're reaching out to you, kind of what that relationship looks like in Oklahoma.
So for us, it's both. So at the beginning of each school year, I contact those who have had us in their schools many years. And then I just send out our information and a hello and introduce our program to surrounding schools in the area and letting them know what we have. Sometimes I hear back from those administrators and sometimes I don't, and that's okay. Every school is different. Like I said, we are currently in one of the biggest school districts in Northeast Oklahoma, and due to HIPAA, I'm not going to say the name of the school district, but they have their own MOU with us. So they have their memorandum of understanding, and there are things that I have to do. Once a month, I have to send them a report telling them how many students we work with. And within Mental Health Association Oklahoma, we have other programs that work in the school as well. So I just do the report for all of them because it's just easier if one person does it. But then we also have to, every 3 months, we have to update. We have required trainings for that district that we have to have in order to go into the school. We had to have background checks, all of those things. But we have schools who reach out to us because they've heard about us from another school administrator. Also, community partners will go to events. Chelsea is very good at events, and she likes to go. And so she also promotes our program out in the community. And then some school personnel might pick something up. And a lot of times, unfortunately, they'll contact us when they've had a loss by suicide. And they want us in for education first. And so then we're in for a screening event, the next year, because it's like that, unfortunately, was an aha moment for them. And so they're like, oh, well, they might have known about our program for a long time, but this happened. And so we've done some education, and now they want a screening event in their school. And it's fine with us. Like we're open to however they want us, but we just do a little bit of both.
Yeah, absolutely. And I think sometimes, unfortunately, schools don't realize the needs of their students until something tragic happens like that. It might be, oh, it's not happening here, or our students aren't struggling in those ways. But the reality is that 1 in 5 individuals has a mental health condition. And so it's starting younger and younger. And especially post-pandemic, youth are really struggling. And
Yeah.
so I think that the pandemic did open up a lot of these conversations, and hopefully schools are starting to see that and reach out to more programs like yours to really be able to implement these types of prevention programs, and then also education and support and wraparound services afterwards. Another question that came through that I'm curious about too is, what does it look like for access to care afterwards? I know you're able to provide them with those resources. Has there been a struggle to access care after screening, especially with workforce issues that are present in the mental health field and just limited resources? Of have you found that your students are able to get support?
I'm going to let Chelsea answer that one.
Sure. Yeah, absolutely. I mean, I feel like everybody has a wait list, and so it can definitely be really difficult. One of the things I wanted to mention is the screening is actually offered in Spanish as well. And so we have a Platicus program at MHAOK that we utilize, and we do have 2 bilingual therapists, but they very often fill up too. And so we have connected with many of the agencies, within our area. It's harder whenever we screen somebody that we're not super familiar with their area. So then that's whenever the research comes in. But I feel like we're only as good as the feedback that we get back from the parents and guardians, because we can refer, to, like I said, agency over and over again. But if we don't get any feedback about it, oh, hey, like this was a really negative experience, then, we don't know. And so I feel like, we definitely do the best we can. And we definitely rely heavily on, whatever information we can get.
Yeah, absolutely. It takes a village. There
Yeah, it does.
are limited resources everywhere, and it's something that we're all trying to overcome. But it sounds like you found a way to provide with some immediate resources like 988 and different helplines, so that hopefully there's some plans in place for youth if they're in crisis until they can get in off those wait lists.
Definitely.
Yeah. You had mentioned too, Chelsea, I'll wrap us up with this question about the parent feedback and how helpful that is. How have you seen parent involvement look like throughout this process, especially with younger youth, where they might need a little bit more support with their parents throughout the screening process? What does that look like?
Sure, absolutely. So it's different for everybody. Sometimes I have parents, as I said before, who are really not interested in, any kind of support. And, it's unfortunate, but I still send them resources just in case they ever change their mind, and they still have our contact information so they can always reach out. But I did have a student in particular who I was thinking about the other day. They identified as a he, and that was different than what the parent was aware of. And during the screening, they actually came to me and they said, hey, I would like to come out to my mom. Would you help me? And the mom wasn't actually surprised, and so I feel like you just have support that varies all across the board. And so, we can definitely support them with wherever they're at. And then, like I said, provide resources for, in case anything changes in the future.
Yeah. And we
Absolutely.
refer a lot to our community partners. So not just the resources in the school, but we have community partners that we work with, that we make referrals to. So
Absolutely. I saw a comment in the chat too about checking out your county resources and being able to start there. That's a great space for people that are
yeah,
listening, of knowing what's available in your area, checking through the county and really seeing there are often resources out there that you might just not be aware of, or that might address certain things that you thought were out of their scope. So really broadening that is helpful.
absolutely.
I know we are right at the end of our time here, and I want to thank you, Cheryl and Chelsea, for being here today, sharing this really important information with us. I know we didn't get to all of your questions, but we'll send out some materials in the follow-up that will have the survey included, that you can get more information about their program, about MHA Oklahoma, learn more about the services they provide. And we will also send the recording so that you can share this with others. You'll receive a certificate of attendance that will come And we also have a survey. So once you close out of the Zoom, it'll automatically redirect you to the survey for today. We would love your feedback, love to hear from you. We will be having more of these conversations. And so feedback you can provide on what topics you want to hear from and what you find most beneficial is really helpful to us. We want to again thank SAMHSA for sponsoring today's webinar. Without them, this conversation wouldn't have been possible. So thank you to SAMHSA for being our sponsor. And thank you to our team here today, to Cheryl, to Chelsea, and Anne. Thank you for our ASL interpretation throughout the last hour. And lastly, thank you to all of you for joining us, for your lovely questions, for your comments, for the resources you've shared in the chat. It's all very helpful. We will be sending our follow-up materials to you all within 1 week. So you'll receive the additional resources, you'll receive the link to the recording and your certificate of attendance. And with that, thank you all so much. We hope you have a great rest of your afternoon.
That concludes today's session. You may now disconnect.